Thanks so much for joining us, Natalie and Lauren.
Hey, I'm gonna start. I'm Natalie, and I'm the Director of Operations, and Lauren is the Manager of Client Services. So I'm gonna go through the first few slides about the organization, and then Lauren will pick up a little more about the services. So just let me figure out. I am not used to Zoom. Use Teams, so let's just see if I can do this. Can you see my screen?
Yes.
Yes. Okay, great. Okay, so if I can get it to move, we'll be in good shape. Okay. Just want to let you know that all of the pictures that you see on these slides are our clients, our volunteers, our staff, our independent contractors. So if you see somebody you recognize or somebody you know, it's because, yeah, these are real people in our community who we serve. So caring for our community at home, exactly what we do. We support people in the community by making connections to services and programs and just trying to keep people independent in their own home for as long as possible. Our mission is enabling people to live at home with independence and dignity. Just a little bit of information about the work that we do. We are a local charity. We work with older adults and adults with different abilities to help them stay at home. We have approximately at any given time, maybe 90 staff members, 450-ish volunteers, 165 independent contractors, and we serve approximately 6,500 clients a year. So just to give you a little bit of the scope of what we do. So we do provide different geographies. So we do serve in Kitchener, Waterloo, Cambridge, and North Dumfries, including Ayr. We have some services in some cities and not in the others, just because of traditional geographic funding from the government. But for the most part, what we do is connect people. So if we don't provide the service in that area, we will connect you with the person who does. And for the most part, we're not giving you a phone number. We'll actually make a connection. So we'll say, can we call them for you? Can we have somebody get in touch with you? Because we know that often if the client has made an effort to reach out the first time, they're less likely to do it the second time. So we do try to make those connections. And we also follow the clients for the duration of the time that they're with us. So we'll do regular check-ins with the clients just to see how they are, how everything is going, and if there's anything else that they need. So we do work closely with Waterloo Home Support, City of Cambridge, and Community Care Concepts, and VON, who provide similar service just in different geography. So who do we serve? Majority of our clients are older adults with or without disabilities. 73% are over the age of 70, 34 are over the age of 100. And to be completely fair, most of those are exercise clients. Most of those clients are in the exercise classes. So I think that's a great thing. That's amazing. A lot of the people that we serve have physical limitations or chronic illness. Some of them is for caregiver support are still our biggest sources of referral are self, family, or friend. So those are still the two biggest ones. So which is why we're here. Because we could definitely use referrals from other places. Ontario Health at Home is also somebody who refers quite a lot. And approximately half of our clients have more than one service. So we do have some clients who have one service, but a lot of them have more than one service to help them stay independent at home. Service umbrellas, so just to strategically focus in 4 areas. Most of our services are free, but we do have a few programs like Meals on Wheels, transportation, where we have a fee for service that helps us to reimburse either volunteer mileage or to help pay for food costs. The majority of our funding does come from the province through Ontario Health, but we do fundraise over $300,000 every year so that we can provide services to people so that they can afford them. So we do have a sliding scale for fees so that people can actually pay what they can afford to pay for the services. Thought I'd just give you a little bit of the numbers. The pandemic greatly affected our services. We halted a lot of the services for months and months during the lockdowns, and exercise and transportation are two of the hardest hit services who are really just starting to bounce back now. Pre-pandemic exercise was probably at 243,000. And now we're at 73. So, and transportation was probably around 27,000 rides. So the other services seem to bounce back much quicker. Exercise and transportation much slower. But it sort of gives you a scope of the services that we provide. 88,000 meals, that's a lot of meals. And if you add in Lego, which we are part of the Lego program, we did an extra 10,000 meals for Lego last year. So that's a little bit about the sort of the basics, and I'm going to hand it over to Lauren, who can talk to you about the services.
Okay, so the first service we'll chat about is our Meals on Wheels service. So this service is meant for people who have difficulty preparing meals or are interested in maintaining or increasing nutrition or healthy eating habits. We have a variety in our menu. We offer frozen and hot meals. The meals are delivered by volunteers Monday through Friday over the lunch hour, so generally between 11 a.m. and 1 p.m. We opened our own kitchen in 2014, and we can accept fresh local food donations, and we invite volunteers to come in and help us prepare food to keep costs down while we try to improve the quality and value in our meals. We've also been fortunate enough to receive support from 100 Women Who Care Waterloo region to build an on-site garden, which has also increased our individual and group volunteer opportunities while allowing us to further increase our fresh local content. We offer this program in Cambridge, North Dumfries, Kitchener, and Waterloo. And this is one of the services that would be on our sliding scale. The nice thing about our meals program is that clients are able to decide if they would like to have our full meal, which includes an entree, a soup, and a dessert, or if they'd like just the entree or the soup or dessert. So the entree plus one of the sides. I'm going to flip to the next slide, Natalie. Okay. We also have a grocery shopping program, which is part of our nutrition service umbrella. We have varying different programs for this. So if a client actually just needs a ride to the grocery store, that's something we could do. We would pick them up, drop them off at the grocery store that they'd like to do their shopping in, pick them up, and then bring them home. We have our assisted shopping programs, and there's a couple of different ones in here. So we have an escorted shopping program where we would match a client with a volunteer who would take that client to the grocery store, support them in the grocery shop, and then return home with them. And then we have our list shopping program where clients would provide us with a list and with cash ahead of time, and we would send a shopper out to the grocery store for them to do the shopping. They would pay for the groceries and then bring them back to that client. We can sometimes help people put groceries away if needed, but that's typically on a very need basis if there's clients who really, really need it. But we do help get things to the door. Oftentimes people will say, I take a taxi and they just dump everything in my driveway and leave me alone. But we try to help them get it to their driveway so that they're not stuck trying to lug bags of groceries up snow-covered stairs. So those are a couple. We also do offer a grocery shopping pickup. So if a client wants to order their groceries online on their own, but can't get to the store to pick it up, we can arrange that for them. There is a fee for this service as well. It is based on our sliding scale, and we offer it in Cambridge, Kitchener, and North Dumfries. Our exercise and fall prevention programs, we partner with Community Care Concepts and Vaughan to provide smart, gentle exercise classes in Waterloo region at over 100 locations. Exercises can be done in seated or standing, and we aim at improving functional fitness, including strength, balance, endurance, and flexibility. We have kinesiologists who hold virtual and in-person education sessions where they teach fall prevention techniques and incorporate gentle exercises to help reduce the risk of a fall. We also offer these classes online. So clients have the option of going in person or doing them online. Each site classes are offered 2 to 3 days per week. They're only offered on weekdays. Typically, I think there's more classes in the morning than there are in the afternoon, but there are some in the afternoon as well. And then we also have exercise programs available one-to-one in home for people who are not able to attend groups. Our Smart One-to-One program requires a referral from a registered health person, but our FabFit program does not. All of our exercise and fall prevention programs are offered for free throughout the region, and we offer them Cambridge, Kitchener, North Dumfries, and Waterloo. Then we have our social well-being program. So our caregiver support program, which is a free program, offers support to caregivers. There is no limit on who the caregiver is. So the caregiver could be somebody's aunt or cousin. We don't have a specific type of person that they have to be caregiving for. So an example I often give is the Canadian Cancer Society. They might have a support group for people who are going through cancer. They can come to our support groups, but we don't limit it to seniors or anything like that. If they have somebody who is providing caregiver and needs some support, they are welcome to join our groups. We do support groups virtually and in person. There are groups in person in the major cities in the region. And then we have our virtual options. We also do education sessions. Those are typically 4 to 6 weeks where our staff go through with caregivers and discuss caregiving issues like respite and self-care and things that will help support them on their caregiving journey. These services are all free. The caregiver support services are all free and offered within the region as well. Our transportation program, we have, it says here 25 volunteer drivers, but I feel like there might be more than 25 volunteer drivers. But we do have a fleet of agency vehicles, and between the agency vehicles and our volunteer drivers, we take individuals or groups of clients to medical appointments, either in town or out of town. We can take to specialist appointments in London, Hamilton, Guelph, anywhere that they might need to go, the GTA, if we can find someone to take them. There is a fee for service for this, and it is also based on our sliding scale. Our friendly visiting program is a free program where we match eligible clients with a volunteer for weekly visits or chats. This is reserved for clients who are truly isolated in their own homes. There is a wait list. It is a volunteer-based program where we match based on interests and location. We do offer this program in Kitchener and Waterloo. Friendly visiting in the city of Cambridge is done by the city of Cambridge. And then our reassurance call program. So this is a program that we offer where volunteers call clients weekday mornings, generally between 9 a.m. and 11 a.m. for a safety check. So they just call in to make sure that they're up and about, that they're all right, checking to make sure that they're answering the phone. We will follow up with emergency contacts if we cannot reach the client that day, and then pursue further follow-up if we cannot reach emergency contacts or they cannot reach the client. This is a free service that we offer it's a really great program, very helpful. We have helped some people in some sticky situations because we called them and they were on the floor. So yeah, it's a great program that we offer for free. Our Help at Home programs, these services are all offered by independent contractors, so there is a fee for service. Our home maintenance program are just simple home projects that are outside of trades. We match with a screened independent contractor. These are types of things that might be like fix a leaky faucet, help change some light bulbs, hang some pictures on the wall, that sort of thing. They're not going to patch a driveway or something along those lines. We've had requests like that before, but that's not what the program is. It's just simple home maintenance jobs. I'm just going to skip over homemaking really quick. Snow removal is our Snow Buddy program, where we match clients with an independent contractor, and they will come and shovel their driveways and their sidewalks to help keep them clean. And yard work is the same, but for yard, we're going to cut the grass for them in the spring and the summer. We match them with a worker, and they will come out and cut the grass as needed. And then our homemaking program is a light housekeeping program. We can help with laundry and some other tasks as needed. The flat rate for this is $22 an hour. Oh, I just lost my train of thought. I'm sorry, everybody. But yeah, they are homemakers. We match them with our clients. They go out and just do the light housekeeping. So sweeping, mopping, helping in the bathroom. They might help clean like dishes in the kitchen. They may help make a light lunch for somebody if they're out there around the lunch hour. Yeah. So there are wait lists for these programs while we work to get clients matched with our workers. It's typically not a very long wait list. It's usually a couple of weeks and we can get people matched. Okay. So to refer to our services, there are a lot of different ways that you can do that. So you can use CareDove, and by CareDove, if you just go search for the service, or by Community Support Connections, we should come up and you should be able to send a referral. You can call our office. That extension is my extension, so you can have a chat with me and we can get an intake booked for your patients, I guess, to get a connector to come out and see them. You can also refer directly on our website. So if you just search up Community Support Connections and go to our website, there is a button that says services and it says register now, and it should give you the option. The nice thing about CareDove when you're booking it is if you want to refer somebody for homemaking, you can also refer for transportation at the same time. It should give you an option to check so you can do one referral for multiple services. You can use Ocean, again, just search by the service name or by Community Support Connections. And we also will still receive referrals by fax. So you want to take this one, Natalie?
I just want to talk about our volunteers because you know what? None of this is possible. Brought to you by the generosity of the community. Without these people, these 450 to 470 people every year, there's just no way. I think 2 years ago, I think even during the pandemic, we figured out that it was probably about 19 full-time staff. The hours that they put in for a year is the equivalent of about 19 full-time staff. So yeah, they are amazing and none of this could be done without them. And then this is just, you know, we have so many stories. I could keep you here all night, but I won't. But it just makes all the difference in the world to them. Just this little thing that helps them to stay at home sort of makes it worthwhile for them. So questions?
We switch gears now. There we go. And introduce you to Danielle Hughes. So she's from Waterloo, Wellington Self-Management Program. She's going to give you, again, lots more information, but they offer free workshops and continuing education opportunities designed to support individuals living with chronic conditions, their caregivers, and their healthcare professionals. And so I just want to introduce Danielle to all of you, and I look forward to hearing more about her programs.
Amazing. Thank you so much. Thank you for having me this evening. Just before I share the presentation, I'm really excited to share we actually got a brand upgrade. So we have a new logo and everything, and this is only my second external presentation sharing that new logo. So we're really excited about it. But let me get that up here for us. All right. Okay. Thank you again for having me today. My name is Danielle. I'm a registered respiratory therapist and the program coordinator at the Waterloo Wellington Self-Management Program. So we'll dive into all of the good stuff, who we are, who we serve, what we do, all of our programs, how registrations work, and then leave space for some Q&A. So nuts and bolts, the Waterloo Wellington Self-Management Program, we're actually one of 14 self-management programs in Ontario. We're each aligned with a geographic area following the old LIN boundaries. So we cover Waterloo Wellington, of course. We're actually an outcome of the Ontario Diabetes Strategy, but our focus is self-management for all chronic conditions and also to help support self-management support skills for health professionals. LANGS is our host organization, and we actually are located within the Regional Coordination Center and work very closely with Waterloo Wellington Diabetes. So our organization, we really hope to empower individuals and health and community care professionals through our self-management education, and with the end goal of strengthening the quality of life for individuals living with chronic conditions and helping to build a healthier and more resilient community. Our core services, of course, are the free self-management programs and our workshops and educational events that we have throughout the region. All of our participants are very diverse, but united by that shared goal of improving health outcomes and enhancing quality of life through self-management. So our participants include individuals who are living with or at risk of developing a chronic health condition, their caregivers, as well as health and community care professionals who support them. So the gist of what we do, we organize those workshops. We're with the pandemic, we shifted to virtual, of course, as many did, and very slowly starting to get back to in-person sessions, but definitely finding that the majority of individuals are still finding the virtual sessions are quite convenient, especially when we're dealing with a chronic health condition, the trying to figure out rides to different places and that sort of thing. Can be difficult, but there has been a slight increase in ask for in-person sessions. And we've been fostering some connections in the community, currently doing a lot of great work with the Cambridge Library to get our programs out there. And so we also work with organizations. So we have partnerships with the Cambridge Food Bank. Their health promoter works with us and is a certified leader through our programs, and she delivers all of our programming for the clients there. We also work with some family health teams in the region, including the New Vision Family Health Team and in Minto Mapleton. So they have dietitians or health promoters that will get trained in our programs and deliver within their communities and offer that in person. We take care of the management of the certified leaders, so the scheduling, recruitment, and training, and we cover the costs involved with that process. We promote the programs, lots of outreach, so you'll usually find us at all of the health fairs in the area. We are doing some social media promotion, we share within our networks, and even getting back to some of the basics, we've been getting out into the community and getting flyers up in community boards to try and reach more and more individuals. And then efforts like tonight, being able to share all of our services with all of you. We handle the registration for programs, so keeping everything really streamlined for participants. It's all through our website and very simple, or they can always call and we can help them to register for a program. We provide their support, so we do reminder emails and phone calls. And then we supply all of the workshop materials, so any resources that are necessary. Each program is a little bit different. Even for a virtual program, if it's a book that they receive, we mail that book to them, so they still receive that hard copy. We collect feedback at the end of each of our programs so that we can ensure that we're meeting the needs of the community and to get a feel for other interests that they may have. And then we would ensure the program quality, maintaining the fidelity, licensing, and reporting across the various programs. And each one's a little bit different, of course. So last year, we hosted 81 events throughout the region. We trained 630 individuals in self-management skills and 271 professionals. This year, we're in Q4 now, but we've had a large uptick in our professional trainings and educational events, and we're already surpassed 300 healthcare professionals this year so far. So we do provide a variety of programs. We really aim to bring evidence-based programs into the community. The core programs that we have are the Take Charge. So there's 3 variations. There's a chronic conditions program, which is a very generic base program for that, the chronic pain, and then there's a diabetes specific self-management program. All of these programs are based on the programs developed by Stanford University, and they are now being administered through the Self-Management Resource Center. So each of these is a 6-week workshop, and the participants get together once a week for 2.5 hours each week, and they develop skills in self-management, stress management. They talk about communication, action planning, and problem solving. The specialized programs like chronic pain, we talk about things like planning and pacing, and there's even a easy moves program to provide some gentle exercise and movement. And in the diabetes specific program, we talk about things like an introduction to basic foot care and things like sick day management as well. Each individual will receive a book for the chronic conditions and diabetes. They get Living a Healthy Life with Chronic Conditions, and it's a fantastic textbook. I keep it as a kind of resource for myself to look back on. And then for chronic pain, they get the book Living a Healthy Life with Chronic Pain. We offer Creating Change, which is a huge demand actually in our community. This program is often referred to from the bariatric clinics. And this one is a little bit different because this has to be delivered from healthcare professionals. So we do have some volunteer healthcare providers in the community that help to support bring this forward. And this is actually a Canadian-made program from BC. It's a 4-week workshop to help improve your relationship with food through understanding eating habits, finding non-food comfort, and changing your thinking. So it has a cognitive behavioral technique approach. And there is a lovely workbook that participants receive for that. We have Getting the Most from Your Healthcare Appointment is a nice little short workshop that helps people to think about what to do before, during, and after their healthcare appointment, and really has that health literacy base behind it. New to the program are the Health Matters programs, and these come to us from ABC Literacy. So they're all health literacy based programs. Each one is an hour to 90 minutes and really discussion based. So we have the healthy caregiving, organizing care, and take charge of your health. And these ones have been a lot of fun to get up and running. We have our Powerful Tools for Caregivers, another evidence-based program. This is also a 6-week program. There are 90-minute sessions once a week, and it really helps caregivers to gain self-management skills for themselves and to help reduce stress, boost their confidence, improve communication. So there's topics like having those difficult conversations. And they receive a lovely caregiver's handbook with this program. We also have built a really great relationship with a local registered nurse and menopause coach to bring menopause awareness workshops. This has been quite the topic and a lot of interest involved. She provides a introductory workshop that just gives kind of a general basics of menopause, as well as a 6-week program that she does with a little bit more coaching for a small group of 10. And then some specialized menopause topics. We're doing a menopause and chronic conditions coming up in March. And she has some around menopause and mental health, as well as menopause and the workplace. And we're just getting everything in line. We've made a partnership with Pain Canada, and they have a program called Making Sense of Pain. It is a 10-week facilitated program, and really excited to share more as we have all those details coming forward. For the community, we also have built a great partnership with Kathy Summers from the Stress Management and High Performance Clinic in Guelph. And she brings forward these really great workshops. We'd worked with Kathy for a really long time with the Better Sleep, Dial It Down, and relaxation techniques. And they're all programs that have amazing feedback. And this year we've added in the anxiety skills and strategies and stop worrying. Each of these programs will vary in length. Anxiety skills and strategies is 1 hour a week for 3 weeks. Better Sleep is a 5-week program, as well as Dial It Down. Relaxation techniques is a really quick 1 hour, and it's absolutely fantastic. And then her Stop Worrying, which is a single 2-hour session. And yeah, really looking forward to it. We've had amazing response to all of these topics. That hits our community programs, and we're always working with the community to see what the need is, and even from healthcare providers, if you're noticing a need, we're always willing to do the research and see what kind of partnerships we can develop to bring more to support the community as best as we can. For healthcare providers, we have several professional programs that we offer fairly throughout the year. The first 3 come from CCMI. The brief action planning is a 10-minute structured approach to using SMART goals, using motivational interviewing to help individuals create and follow their own self-management plan. And that is about a 3.5-hour workshop. We have health literacy, which covers health literacy basics and the core skills like using resources, plain language, teach back, and ask, tell, ask. These are single sessions as well that run about 3.5 hours. Informed decision making is new for this year. That'll be coming a little bit later in 2025. But it's all about engaging, all about supporting clinicians who engage patients in decision-making through practical tools using the BRAIN worksheet. And that one's about a 4.5-hour session. We also do mental health first aid. We usually offer that 1 to 2 times per year. And we have motivational interviewing. We've developed a really great new relationship with the Monarch system, and they deliver a level 1, 2, and 3 in motivational interviewing. We're having our first level 1 program with them coming up this March. And that is over 2 3-hour sessions. So we get together on the first day, have discussions, go over various topics and scenarios, and then a week later come back and do the second 3-hour session so that there's time to do some integration and bring forward additional questions. We also support lunch and learn sessions because being self-management supports, we need to take care of ourselves as well. So we work with Kathy Summers, and she has these are just a couple examples, but lots of different variations. We're doing an energy boosters for the Lang staff next week, actually. But she'll do a 1 hour on smart stress management or smart heart health stress management, tips for better sleep, those sorts of things. And in the past, we've done partnerships with Waterloo Wellington CMHA to do the empathic strain workshop. And we've done some amazing work with Dr. Michael Vallis as well, talking about behavior change and motivational interviewing as well. So registration for community programs, individuals can go onto our website. When you go on to the landing page, you will see this option and you can choose to go into the community side or healthcare professional side. Patients can also be referred to our program through Ocean. And then for professional development programs, they are all listed on our website and you can find them through our social media as well. And that's me. So any contact information, if you have any questions or think of anything down the road, please don't hesitate to reach out to me directly. We also have a general email that you can contact, the self-management@langs.org, and happy to help with anything that comes up.